This episode of Angles is brought to you by Richmond Vona Personal Injury Attorneys. Expect high-level communication, transparency, and cutting-edge technology to keep your case moving. Expect a legal team that's laser-focused and moves fast to get the results you deserve. When the unexpected happens, expect Richmond Vona. Learn more at richmondvona.com, 192 Seneca Street, Buffalo, New York. Welcome to Angles, the podcast where we dig into the stories behind impactful people and explore the sharp turns, daily decisions, and defining moments that shape how they got to where they are and how they keep moving forward. I'm John Richmond, and every week I sit down with guests who are building bold, meaningful lives and careers in Buffalo and beyond. If you enjoy these conversations, please hit follow, subscribe, drop a comment, or share the episode. It's a simple way to help us grow with the community and keep these stories coming. Hey everyone, October is Breast Cancer Awareness Month, and I'm honored today to sit down with Dr. Helen Cappuccino, board-certified breast surgeon at Roswell Park Cancer Center and a driving force behind life-saving treatment right here in Buffalo. We dive into the new treatments wiping out tumors before surgery, the simple screening habits that catch cancer early, and why empathy, research dollars, and community support all matter. Whether you're a patient, partner, or just someone who cares, you'll take something away from this. Let's get into it. All right. Well, I am really honored to be joined by Dr. Helen Cappuccino. She is a breast surgeon in the Department of Surgery at Roswell Park Cancer right here in Buffalo. Dr. Cappuccino, thanks for being here.
It's a pleasure to be with you.
Really excited to talk to you. And, like we were talking before we started, I've heard a lot of great things about you. And, there's a lot of topics I want to cover today, especially in light of the fact that, we're in October and, as I told you, I'm part of the Real Men Wear Pink campaign as part of American Cancer Society's efforts to raise money for breast cancer research. And I wanted to kind of, just start off in the beginning. And I'm always interested to hear, how someone like yourself, got into medicine and kind of ended up in the position you're at Roswell.
So, I'm the kind of person I think I could have been happy in just about anything I put my mind to, but I always love science and, the typical cliche things. I love helping people. I love science. Medicine's such a good fit. There are so many other professions that also do that, but mom and dad really encouraged me to pursue medicine, and I loved it, and it was a good fit. So went into that, 4 years of medical school. I love the pace of surgery, the immediate gratification of it, and decided to do a surgical residency. And then I went into private practice when I finished, hung a shingle the old-fashioned way in my hometown. And I found that I was seeing a disproportionate number of women with breast cancer because I was a female surgeon. So I had gone to Roswell at that time to learn some new techniques that had just come out. And they liked me and asked me to stay on and help. And over the years, they've just kind of reeled me in to do more and more, so that now I'm exclusively at Roswell. I no longer, many years ago, I gave up my private practice and have just, stayed at Roswell and really enjoyed the work that I get to do there.
Yeah, I've heard a lot of doctors say that, and sometimes they say they realize it in the beginning or maybe a little bit into their careers, that they felt like medicine was a calling for them. Does that resonate with you at all?
Yeah, it definitely does. There are easier ways to make a living, especially in this day and age. There's a really dense regulatory environment surrounding medicine, also a lot of compliance with insurance companies, with just rules, regulations, et cetera, things that are obviously put in place to protect patients, but can be really difficult and cumbersome. And so it makes it not easy to do medicine. So you really, I think, have to want to do it. But to this day, I would make the same choice every day of the week. I love what I do. I love taking care of patients. And caring for breast cancer patients is kind of unique because, in my opinion, it has all the positives of a primary care practice. I get to talk to the people, I get to know them over several years, but I also have really the gratification of being able to operate and remove their cancers and help them to be on their way to cure. So it's really just, I think, the best of all possible worlds for me personally. I really like it.
Yeah. And was there like a time early on when you were in private practice, or maybe a specific patient or an instance where because I know you mentioned you were seeing a lot of breast cancer patients and, helping a lot of people, going through that. Was there a particular time or instance where you just finally said, "Hey, I just want to devote my whole career to this"?
Know that there was sort of a moment where I pivoted to that. What I would say is, I was in surgery already, and I really liked that quite a bit. But going to the breast surgery for a number of years, I was doing both my private practice general surgery as well as Roswell. And with time, there were a lot of compelling reasons to just dedicate myself completely to breast cancer care. Just I really like getting to know the patients well and to be a part of their, making their journey as easy as possible. And fortunately, when you're doing surgery for breast cancer, more often than not, the patients are being treated for cure. So that's very personally gratifying and really exciting to be a part of that journey with patients. But even in the cases where there's like not as good of a prognosis, I like to think that I come to it with compassion and empathy that helps to make even that part of their journey a little bit easier. So there's a lot of ways to really help people with cancer. Surgery is just one part of what I do.
It's amazing that you have that opportunity and you're there for people to like you said, like help hopefully cure the breast cancer through your procedures. I got to imagine though there's a lot of hard times, a lot of hard days. That's got to be really heavy emotionally at times. How do you manage that and kind of recenter yourself when you maybe are dealing with some people who you really kind of feel bad for?
Yeah, like I said, most of the cases most of the people that I take care of in the cases of cancer that they have are treatable for cure. Sometimes it's like a really difficult pathway for them, and there's real gratification in helping them to get through that. But yeah, from time to time, I see some really awful things. It's it's impossible not to relate to that personally. Breast cancer runs in my family, so I'm of the mind that someday I will have breast cancer. So it's very personal. My husband had a serious cancer that he fortunately was cured of because of Roswell. But on the days where I'm like really feeling that, I think just talking to colleagues, sometimes talking to my husband, who's also a physician, just sometimes you have to share that to sort of share that burden, and the other thing that I think helps is that I, have a little bit of a commute. So I've got some time to gear up for my days and wind down at the end of the day. And that really just helps me to center and think about what I've dealt with and it helps me to think about how I can best confront that and take care of the patient despite it being really tough. I'm not of the mind. Some people say, oh, you have to stay removed and out of it emotionally or else it'll be too draining for you. And I'm the exact opposite. I feel like if somebody can easily separate themselves emotionally from patients, they are the opposite of who should be taking care of patients. I think you need people who are deeply empathic to be in those exam rooms, to be in the operating room with those people, to be holding their hands while they're falling asleep, and reassuring them. And, if they want a hug, I'm like a hugger too. Like whatever helps somebody to get through that journey.
Yeah, I mean, look, I fortunately have never, been through cancer myself, but have a lot of family members who have, and I just know how important it is when there's doctors like yourself who really, like you said, just care so much and really want to be there for people. I mean, I know that means a lot. And I've heard just such amazing stories, whether it's about you or other doctors at Roswell. And I know that all of us here in Buffalo feel very fortunate to have Buffalo right here in our backyard. I know you said that they kind of slowly sucked you in out of private practice.
Mhm.
What do you think, or what are you most proud of at Roswell, or what do you think are the biggest benefits of being able to treat people at Roswell?
So, I'm just one small cog in the whole machine. And I think one of the most appealing things about working at Roswell first is that I am surrounded by other expert physicians. It's not just me, but I have a pathologist that specializes in breast cancer analysis. I have radiologists, my dear friend Ermelinda Bonaccio, runs that whole department and is really skilled at what she does. I trust them to read my own mammograms, right? So these are like really expert, fantastic people. The medical oncologists that do the chemo, the radiation oncologists that do the radiation, and then all the nurses and the PAs and the NPs and the anesthesiologists, all specially trained to take care of these patients with sensitivity and expertise. We all sit down and talk together every Monday morning about the cases that have any sort of a dilemma, a treatment dilemma, or if there's particular social concerns. We all brainstorm together to try and make sure that everybody gets really the best possible care possible. And a place like Roswell invests in the best possible equipment to treat the patients. So we always have access to cutting edge, devices, technology. There's research happening real time has been generously supported by our community and several grants. And that's really critical to making sure that patients get the best possible care too. They have access to things at Roswell that they wouldn't have elsewhere.
It's got to be so exciting for someone. I guess I kind of sense it in your voice. Like you mentioned earlier, you're a curious person, like you like to learn a lot, and to have all these opportunities to learn, like you said, with new devices or whatever it is, but knowing that it's in an effort to help create better outcomes for people. That's got to be
Absolutely.
pretty amazing.
Yeah, it's exciting. The other thing that makes it really exciting is it's a teaching hospital. So I can't rest on my laurels. I constantly have aspiring medical students, residents, fellows coming through constantly. And I've got to be up to date on the latest things because I am also an educator. So we all kind of bring our best selves to that game to make sure that we are, providing the best care, educating the people around us, the trainees. And it's really exciting. I feel it keeps me current and on the cutting edge.
I'm just thinking about this because you guys are so on the cutting edge, and then when women end up meeting with you for the first time, is it usually the case that you're there to discuss the fact that they need surgery? And if so, I got to imagine that's got to be very overwhelming for people. I'm just kind of curious, like how you help them understand their options and feel better about the path forward.
Yeah. So usually the surgeon's the point of first contact for a breast cancer patient unless they have spread elsewhere in the body. So I'll usually be the first doctor that they see, and will on the day that I see them, usually my pathologists and mammographers have evaluated all of the studies that brought them to that diagnosis. So I'll sit down with them, talk about exactly what the diagnosis is, how we characterize it, what the prognosis is, what interventions are likely to be necessary. And then I just sit and I ask if they have any questions. And more often than not, the prognosis is much better than they expect it to be. So I frequently find myself in a position of talking them off the ledge a little bit, telling them, listen, your prognosis is great if you do X, Y, and Z, and here are your options. Or if it looks like it's going to be a more rigorous course of treatment, explain to them why we do it, what the rationale is, what the decisions are that need to be made. And there are very few things that are completely black and white in their decision making, but I really try and go through the pluses, the minuses, the risks, the benefits, what's the best case scenario, what's the worst case scenario, and how to get them there. But more often than not, I'm trying to reassure them and encourage them to have a smaller operation than they anticipate that they needed when they came in. A lot of women come in asking for bilateral mastectomies. I'm like, no, actually, really, your prognosis is just as good with a lumpectomy where the cancer is, and you're going to go on to have at least as good of a survival, and you'll be able to maintain your own body's integrity and feel good about yourself.
I got to imagine through all these conversations with patients that at times you've probably at times even learned a lot about fear or like basically fear and resilience from them. I mean, these women are so brave and sitting there with you and going through this process with you. It's got to be pretty amazing.
It really is. I never cease to be amazed by just the quiet inner strength of most patients that are going through this. Obviously, most of my patients are women, not all of them, but most of them. And a lot of times they're young mothers. And for them, much of their angst and worry isn't even about themselves. They're worried about their kids, they're worried about their husbands or their partners. And I find that it's not just the patient, but their partners that are also really struggling too. So, having been having a husband with a serious illness, it really made me very sensitive to what partners are dealing with at the same time. So I try not to lose sight of that, but sometimes I really have to encourage them to let their guard down and say, hey, this is a safe space. You don't have to be strong for anybody here in this exam room. I'm here for you. And, tell me, what is it you're afraid of? What is your deep, dark worry? And it just amazes me because more often than not, it's not even about themselves. It's about the people that they love in their life.
I got to imagine that, at times, like when you're telling, like a patient, like, hey, I know that maybe you thought you needed, like you said, a double mastectomy, but there's we can do like, maybe we'll call it like a less invasive procedure. That sometimes there's even that fear of like, okay, you're saying less, but being confusing and them thinking like, is that like not enough? Like just worrying that that's not going to be enough at times.
Yeah, for sure. By the time I see people, even though Roswell makes a very concerted effort to get patients with a new cancer diagnosis in within a week, even a few days on the internet is enough to really frighten a lot of people
Oh
into
yeah.
we need terrible, terrible stuff done. And I'd say the problem nowadays is there's so much information out there, and it's really hard to know what's factual, what's accurate, what's evidence based. So when I see them that first day, I really try to hone in on what they've read, what they think, what they believe, and then tease out the truth from there. And then when we talk about the interventions that they need, to talk about why, what the rationale is, and what the evidence suggests, because we're very much driven by data and evidence at Roswell, and sometimes people come in thinking things. We had a patient a couple of weeks ago that thought ivermectin was going to cure what was going on, and I'm like, well, I know there's stuff available on the internet that might suggest that helps you, and then we go into why there isn't really evidence to show that for breast cancer specifically under these circumstances. And so it's a lot of educating, but also trying to help them to be a better consumer of information because there's too much misinformation out there.
Yeah, I obviously can tell again that like educating is so important to you. And I understand why. What do you wish maybe more people understood about I guess like screening and early detection when it comes to breast cancer? Because you hear a lot about it, but I admittedly don't know anywhere near as much as I should. But what do you think people should know, or wish people really knew about it?
There's several different national organizations, including the government, that come out with guidelines of what appropriate screening is. And while there's some minor disagreements about frequency, when to start, under what circumstances, I think most women seem to know around the age of 40, occasionally earlier, just depending on risk factors, family history, et cetera, they should start getting mammograms. Most people know that. Most physicians encourage patients to do that. So if they're seeing a primary care physician, they're aware, they usually do start getting their mammograms. But I guess really just the importance of sticking with that regimen, maybe getting a risk calculation done if they have anything in their family history or their personal history that we predispose them to cancer. There are a lot of things that predispose people to cancer that not everybody knows about. So having no children, believe it or not, does increase the risk of cancer. So having no
Wow.
pregnancies increases the risk of breast cancer. Having had radiation to your chest increases the risk. Having family members, even in the absence of a genetic predisposition, family history also increases the risk. And there's several other things like lack of activity, certain types of diet. Those are minor risk factors, but everything can make a difference. So, just to open up to the patients about, any questions they have, talk about their lifestyle, what they're doing, how they get there. I think that's really important. And I guess really just to make sure people do get their screening done. That's really the most critical thing.
Are there lifestyle changes that people can make, maybe as early as maybe their 20s or 30s to maybe help lower the risk of breast cancer down the road?
Yeah, there's a lot of data that is very specific about that. And unsurprisingly, it's exactly the things people already know for cardiac health that also seem to be good for certain cancers. And I'll speak specifically to breast, but maintenance of an ideal body weight. When people carry around extra weight, the fatty tissue actually creates the more estrogen to the body and can increase the risk of breast cancer. Lack of physical activity increases the risk. Drinking too much. So unfortunately, alcohol is indisputably a carcinogen when it comes to breast cancer. Now, that doesn't mean everybody should stop drinking everything all the time, but the less you drink, the better when it comes to breast cancer. Certainly anything more than one serving of alcohol per day indisputably increases the risk of breast cancer. Physical activity, getting your heart rate up at least 3 times a week for 20 minutes, maintaining your ideal body weight. Mediterranean diet is fantastic. The one exception to that diet is that it includes a glass of red wine per day. So we recommend against that, but being a little bit more plant-based, avoiding processed meats, getting your proteins through fish, legumes, things of that nature, and having a colorful fruit and vegetable diet, like especially your dark green fruits and vegetables, black, blues, purples, oranges, yellows, reds are all really good.
That's really interesting. It's like, yeah, you're right. It sounds like all the things we're supposed to be doing for a lot of different reasons. Just that's amazing. And I was going back to just quickly talking about screening, and we were talking about mammograms. Do you ever see barriers to women having this done? Especially financial barriers with lack of insurance, that type of thing. And if so, are there any solutions for that, or ways women can still make sure that they're getting their mammograms with the regularity they're supposed to?
Yeah, that is such a great question. There's a lot of buzz going around these days about social determinants of health. And what this is right, the crux of the matter is having access to screening measures. Insurance is required currently under Obamacare to have screening exams covered. So mammograms are definitely covered. Hopefully that'll continue to be the case, but some people don't have insurance. And fortunately, in most communities, there are programs available through either nonprofit organizations or the county that will cover the cost of mammograms. There are mobile mammogram programs also that help. So instead of making the patient go to the mammogram, we bring the mammogram to the patient. So it really depends on where people live. How they would access screening modalities if they don't have insurance for it.
Gotcha. Yeah, that's always something that it's sad with financial barriers, and a lot of ways can really hurt people or prevent them from needing the treatment or in a lot of areas that they need. I was thinking,
Just for 1 second,
yeah,
Roswell does have, if somebody is concerned about that, they can call Roswell, and we have navigators that will help to identify resources for people to get screened, to get evaluated, to get a risk calculation done, to get genetic testing, et cetera. So always start out with a phone call. It can really help.
that's
Sorry to
amazing.
interrupt.
No, no, no. I'm glad you said that. That's really valuable information. Obviously Roswell is a huge research facility. And they just do amazing things in a lot of different types of cancer. When it comes to breast cancer, can you help us understand how research improves like patient outcomes or maybe patient experiences?
Yeah, it's a critical element of how breast cancer is treated. If I go back to when I was doing my training in the late 80s, early 90s, mastectomies were much more common. So it was research that helped us realize that we could do much smaller operations, do some radiation in addition to the lumpectomy, and get at least as good outcomes as we would with mastectomies. In terms of additional interventions. We call that adjuvant therapy. We've looked at radiation, different chemos, now targeted medications that are very specific, especially to some of the more aggressive breast cancers, that are making paradigm changing differences in women's prognosis when they have, especially some of the more aggressive breast cancers. None of that happens without research. And, you know, everybody likes to say bad things about the pharmaceutical industry, but really and truly, they're motivated to come up with these great interventions to help people. And that makes a big difference. But it's really important to still have physicians and patients and hospitals engaged in doing active research, because even once you find a medication that seems to make a difference in one circumstance, then we want to look at different combinations, how it impacts specific populations. It doesn't matter if somebody's premenopausal or postmenopausal, or if they're from a certain ancestry or background. All of these things can make a difference. And that is just, there's no fast way through that. It's just meticulous, time-consuming, and studies that need to be done to come up with answers so they can be broadly applied to everybody with breast cancer at risk for breast cancer.
Are there any is there any research that maybe has gone on recently at Roswell or is going on that like maybe you're most excited about or proud of?
Gosh, there are always things happening at the hospital. That's a tough question. When it comes to breast cancer specifically, or all types?
I guess breast cancer specifically.
Yeah, well, we're working on right now in our department and collaborating with our mammography department. We're working on a new imaging system that uses sound waves and artificial intelligence to look at breast lesions in such a way that it may eliminate the need for biopsies and be able to accurately tell patients what's going on. That's actively going on right now. My department chairman, Dr. Takabi, is doing some fabulous research on really at the cellular level about tumor environments and what predisposes women to certain types of cancer and what types of interventions would make a difference and really optimize their chances of doing well and being cured. We've done things looking at geriatric populations and how to best treat them. Doing smaller operations and lesser interventions, eliminating different interventions and still getting the same cure rates, especially in women over the age of 70. So there's always a lot happening at the hospital and as part of national studies where we're looking at that.
And this is probably an ignorant question, but I know a little bit about kind of like generally what clinical trials are and kind of how they come into play, but can you just talk a little bit about maybe clinical trials specifically for breast cancer at Roswell, kind of how they work, how women get into them, that type of thing?
Sure. So first of all, no one's ever obligated to be in a clinical trial. So I think it's really important to put that out there. And a lot of times for what we would call a routine case, and obviously it's never routine for any patient that has breast cancer, but for the most common varieties of breast cancer, it's pretty well defined what we need to do. Where being a part of a clinical trial makes a huge difference is for refractory cases of breast cancer that seem to be non-responsive to traditional treatment modalities. And then having access to clinical trials can really be the difference between life and death. Being able to try new medications or new combinations of medications can make a huge difference in terms of somebody's survival. And even for patients who are going to do well with whatever intervention we give them, or people who have a very serious and dire prognosis, it may not impact you specifically, but it can help other people. So a lot of people derive a lot of satisfaction knowing that their journey and the suffering that they've been through, that some good can come out of that. Roswell's, one of their greatest resources is we have a bank of different tissues with cancer in them paired with blood samples. And it's a really critical resource for doing ongoing research, not just at Roswell, but elsewhere. And that's like something that's very unique to Roswell.
I know we were talking about clinical trials and research, and I know you don't have a crystal ball, but if you look like maybe 10 years ahead of now, do you see treatment for breast cancer changing, or is there like where do you hope that it goes based on what you're seeing happening now over the next like maybe 10 years?
Yeah. So I absolutely do see that. It's funny. The most brisk improvement in breast cancer treatments, diagnosis, interventions has been in the more recent the more recent years of my career. There was some gradual change early in the early 2000s, but it's the speed at which new treatment modalities are coming out is truly breathtaking. And these are not things that are making small differences. They're making life and death differences, especially for some of the more aggressive breast cancers. Some of the newer medications, when given with traditional chemotherapy, are actually completely wiping out the breast cancer. And then I go to operate on them and there's no tumor that's left, which is
Wow.
just stunning. I mean, it's when you think about it, it's incredible. These are women that have breast cancer varieties that would normally have killed them 20 years ago. And there's technology now down at like the DNA and RNA level that allows us to come up with these treatments that are very, very individualized. And so in analysis of the cancers, but also in the treatments that we offer, they're very cellular level and like very specific to an individual specific tumor. So it's really, really exciting.
We'll be right back after a word from our partners.
After an accident, life can be scary, stressful, tricky. You need Richmond Bona to help navigate the process, because getting a life-changing settlement can not only take time, it can take an emotional toll. The team at Richmond Bona provides high levels of support through all the ins and outs, so you get the settlement you need and the new beginning you deserve.
When the unexpected happens,
expect Richmond Bona.
now back to the conversation. Do you think that anything needs to happen, outside of medicine, maybe with policy, community education, to help us get to hopefully where we want to be maybe 10 years from now in terms of how we're able to treat and cure breast cancer?
That's a good question. What I'd say is obviously research costs money. So having research dollars continuing to come in is critically important, especially nowadays with what's happening federally with the cutbacks and what I would argue are some really suspect health policies that are taking place at the federal level. I mean, it's being cut back. And, in areas that we know we need research money, it just, across the board cuts, or they're holding grants, et cetera. So we need to continue to do research. The money has to continue to come in. But I would say obviously, we want to do research on preventing cancer. It would be great if we don't need Roswell ever. That would be the best possible outcome, is that, we're able to prevent cancer. So whether that's through detection, early intervention, you want to take care of both trying to prevent things. And believe it or not, we talked about some lifestyle modifications. There are some medications for high risk patients that we use. There are ways to prevent breast cancer in some cases, or to decrease risks. Then, of course, we want to catch it early. So we want to really encourage people to keep up with their screening. So anything we can do to help educate people about doing that and making sure they get to the mammograms, sometimes to the MRIs, and then obviously on the treatment end of things with research, that's really important too. But education.
Yeah, and this makes me think, obviously, we have things in the community like the Ride for Roswell, and there's so many other businesses and organizations that go out and raise money for Roswell to hopefully to further research for breast cancer and other types of cancer. And I know that you and your husband have been big into philanthropy for a long time. I think I read that. You've gone to Kenya on medical missions. I mean, you sit on a lot of non-for-profit boards. What, how did you get into philanthropy, and why is it important to you? And maybe like, what advice would you have for younger people who maybe are curious about it, or don't know how to get involved, that type of thing?
That's, gosh, such an important question for our community at large, right? Because I think for us, we feel really lucky in a lot of ways. We've We've got a healthy, well family. My husband survived cancer, but our push to do things like that came before he had cancer. And what I would say is it's just a giving back to the community. We feel really lucky. We got a great education. Um, and we want to make our community the best possible place. Yeah, we went over to Kenya to do things, but we are focused so much more on doing things here in our own community. And everybody can do something. You always talk, it's not just giving money. That's not the only thing. Obviously, that helps. But I always say it's time, talent, and treasure, right? So treasure is obviously money. You write the check and you're helping that way. You may have a particular talent or a license that allows you to do things that other people can't do. I do physical exams on refugees so that as they're applying to come to this country legally, I can document what they've suffered in other countries. I can do that because I'm a physician. So that's something I'm able to do. And, time, sometimes being present, being in the moment, being there to, take care of patients. One of my patients today, she does a greenscaping for a zoo. That's what she does. She has no particular skill that she was going to do, but she found that was like a really great way for her to be fit, to improve the community that she lives in. So everybody has something that they can do to make a difference in the community. And I would say, I think it makes as much of a difference for the person being involved as it does for the people that they are serving. It makes me feel good to be able to do something and, set the example, set the tone, be a part of your community, give back to it.
Yeah, I think that's really, really great advice. Sometimes I talk to people and I think, people want to give back, they want to do good, but they feel that maybe their minimal time commitment or, they don't have a lot of money to give. They just feel like, oh, well, what is this going to do? And it's really, everything counts, right? It's whether, like you said, it's giving a little bit of money or going out and volunteering in the community. And it does, like, you shouldn't feel bad about that, right? I mean, it makes you feel really good. And I think that's a really amazing thing.
Yeah, it's sort of, it's the positive feedback you feel for yourself. Like you feel really good about it. Find something that lights you up, that you care deeply about, that's impacted you personally, or somebody that you love has been impacted personally by. And that's where you make the difference. There's so many great nonprofits in the community that do really important work. So there's something out there for everybody, and everybody has something to give.
Yeah. And, it sounds like, and just in hearing you talking, especially earlier, that sounds like the culture at Roswell is amazing, where you have all these people, like you said, doctors and nurses and, everyone kind of in between that's really aligned in the same mission. How would you describe maybe like the values or the culture at Roswell?
I think Roswell is very intentional about trying to hire caring, empathic people. Many of the people that work there have suffered from cancer or have loved ones that have had cancer. There's really an incredible push right now to be what we're calling like a high reliability organization, where you can count on people to do the right thing. People will, always offer up their best, do their best, double check, triple check. So patients feel safe and cared for through every step of their journey. We've really tried to make navigators available, and those are people that help somebody through their journey, whether it's reminding them of their appointments or cutting through some of the paperwork about getting something done, or figuring out how to get their insurance to cover a service or a test or a specialized treatment. We have teams at the hospital that do all of those things. We try and make available alternative treatments, or not as an alternative to what we know is going to work, but in addition to what we know is going to work medically. So acupuncture, psychosocial services, mental health support groups, all of those things, physical therapy, massage therapy.
Yeah, it's amazing. It's going to be exciting to see, kind of how it continues to grow. I mean, I've been living in Buffalo since 2015, but I grew up in Rochester, and it's amazing to have this type of facility in your backyard, and to know, that there's people like yourself who care so much, and that there's, like you were talking about earlier, younger doctors who are coming in, residents, fellows, who get the opportunity to work with you and other doctors who understand how important it is. So let's say stay on top of the science, on top of the medicine. When you're working with younger doctors or aspiring doctors, what's your approach to them, or how do you try to, I guess, essentially pass on your knowledge to the next generation and make sure they, hopefully, we'll say, like, take the torch and run with it?
Yeah, I think a lot of that is kind of a tried and true system of a lot of observation. They will shadow me, walk around, see how I interact with patients. Of course, I always ask patients if it's okay if trainees join me. But I think there's a lot of that, kind of the, I can't think of the right word, but the person who follows around, like in the trades, they used to somebody doing
Apprentice.
an apprentice. Yeah. Thank you. Yeah. Where they learn by observing, and then under carefully controlled circumstances by gradually doing. And, talking to them, asking what their expectations are. I find that the medical students of today, there's a lot of things that are different about medicine now, maybe healthier in some ways for practicing healthcare providers. There's not that expectation that you're going to be available 24/7, 365. And that's very generational for me. I always have my phone. I'm always available on call to answer a call, even if I'm out of town, on vacation, I'll do that. But I think there's a very healthy, with newer doctors, they are taking times for themselves when they need to stay resilient and healthy. But with the new trainees, they're still coming in very idealistic and eager as all get out to do the right thing. They want to be good doctors. They want to take good care of their patients. And it's really exciting to be around that. And, I was just thinking, as we were talking about this, going back to Roswell and sort of the environment there, I have to say a lot of that does come down straight from the top with Dr. Johnson, who was originally a cancer researcher, and her heart of hearts is still a scientist, but she cares so deeply about the community and doing right at Roswell. Everything flows from sort of having that as a value and a priority, just making sure we're delivering the best possible care at that hospital.
Yeah, it's just impressive. And like I said, I think I just hear so many patients that have such an amazing experience there. And when you're working with whether it's patients or doctors, I got to imagine, or younger doctors, I got to imagine, it gives you the opportunity to reflect back on yourself as a younger person, or when you were in med school growing up. What's maybe a piece of advice that you would give the younger version of yourself, especially when you're starting off in your career?
Gosh, that's a really good question. That is a hard question to answer. I mean, for me, I think, having been in this for literally decades now, I find myself in a position of mentoring younger physicians. And I think that tends to be more often than not younger female physicians. And I just think that women have to advocate for themselves, for their talents. They tend to be team players and less about highlighting what they are doing. So I really encourage young female trainees to make sure that they keep track of what they're doing, because it's important about how they're promoted, how they're treated by their peers. And I think, if I were talking to myself as a younger person, I would encourage me to have done that, and to not be shy about taking charge and speaking up, and always just be true to your own values. Sometimes the whole system can grind you down, but it's never wrong to do the right thing. Sometimes it's harder to do the right thing, but it's never wrong. I always tell my kids, sometimes, more often than not, doing the right thing is the hardest. And what's hardest is usually the right thing. When it's easy, it's usually not going to be the right thing. So
100%, right? Like, trying to do anything the right way is always the hard way usually. And that's why a lot of people don't do it. Same with, like you said, it's some, it can be so much harder to do the right thing because it's easy to cut corners, right? And yeah,
Yeah,
you
and
can't have
that's
you can't have people doing that in medicine. No.
it's way too high. Way,
Yeah, for
way.
sure. So I have to ask, I mean, you have so much going on. You have a big family, you have all these responsibilities at work. I mean, their patients are relying on you. I mean, how do you stay grounded or how do you like kind of manage the demands of everything at once?
It's funny because I'm at a time in my life where actually it's, even though I'm involved in a lot, it's like pretty calm. My kids are adults. We're in the grandkids phase of life right now. So I actually find that it's calmer. It's just easier. But I think the key thing I would say is when it was the craziest, when we were in training and we had a bunch of little kids, it was just really, again, being self-aware, knowing what your priorities are, and being true to those. You have to know what your value system is, and that'll inform every decision that you make. And that's one of what I would say is one of the advices that I consider key, pieces of advice that I would consider key to anybody that I mentor or teach is just, be aware of what your values are and always honor them.
Do you have any routines that are like non-negotiable for you? Like a lot of successful people I talk to have like it's one thing or another. Like do not disrupt like this time in the morning when I read or go to the gym or whatever. Like, or do you have anything like that?
I would say that is a luxury I have never had. It's funny, my husband and I, we would joke about how flexible we had to be about like traditional female and male things. We were both, we had to both be able to do it all. And because one of us was invariably on call, especially earlier in our careers. And no, I think to be that dogmatic about anything is just not healthy. Um, no, I'd like to be open to changes in my routine. I try and get a good night's sleep. I guess that's the one thing I try and do. I'm more often than not, I'm not successful at it, but I do try and prioritize getting a good night's rest.
Yeah, I think that's the most important. I admittedly have been sometimes at certain like parts of my life like too regimented. Um, Unnecessarily, and maybe there's been some benefits to it, but I've learned I think to like loosen up a little bit, or I like to think so anyways. I don't know if my wife would agree, but
Who knows? You got to figure out what works for you, right?
yeah.
It's different for everybody. And you know what? It's different in different phases of your life, too. What works for you at one point is not going to work for you at another point, usually. And just be open to that, I suppose.
I think that's really good advice. And it's interesting because like different, we go through like the life is a journey, and I think you got to just continue to keep yourself open to new opportunities, and sometimes being so regimented can kind of leave doors closed that should normally be open. Um, so I guess, as we're nearing the end here, I'm just curious, I'm sure there's a lot of women who maybe get nervous about going for a breast cancer screening or, for one reason or another, they're living in fear about something with cancer. What message would you want, anyone listening to hear about that?
If that's a barrier for you, is sort of that fear and discomfort, bring a friend, go with a buddy that also needs to get screening. If that means you wait 2 extra months and you don't go the month you're scheduled, you're going to wait instead of going in December, you're going to go in February, but you're going to go with a buddy and you're going to do it every year and you're going to have lunch afterwards. I think that's a really helpful strategy. For instance, my daughter and I are on the same schedule for our screenings. We're both going through what we call enhanced screening because we're at increased risk for breast cancer. And so we always check in with each other on the months that we're supposed to be having our screenings to make sure that the other is doing it. So just, the buddy system really helps. I think that, obviously the messaging is that it's much worse to wait and discover it because it's, now you feel it and it's large. It's much more important to catch things early.
And I guess my last question for you is, I mean, it's obviously you're creating a pretty amazing legacy, whether you look at it that way or not. I mean, just as a mom, a grandmother, a wife, a doctor, everything you've done in the community. How would you want, like, maybe your patients, colleagues, your family to, um, I guess, think about your legacy going forward, basically looking back on everything that you've done?
That's like such a big question. I just I just want people when they think of me, I want the first thing to happen is for them to smile, right? I will hope that when people think of me, it's because I've had a positive impact on them in some way, whether I told them a good joke or I helped them get their cancer or I gave them a hug at the right time or, I made something easier for them or said something that resonated. That's all. I just want to know that I've just impacted on people in a positive way, as much as I can.
I mean, you are an extremely positive person, and it's a reminder that positivity is infectious. And so, look, I really appreciate you being here. I mean, I've learned a ton just sitting here talking to you for the last 45 minutes. I could talk your ear off forever, but I promise I won't do that to you. But thank you so much for coming on, for talking to us. I know a lot of people are really going to gain a lot from listening to this conversation. And like I said, I just really appreciate it because I know your time's really valuable.
Oh, it's entirely my pleasure. And thank you so much for getting the word out, continuing awareness about breast cancer and screening and making sure we're able to do the research that we need to. And of course, about getting the good news about Roswell out there in the community. It is really a treasure. We've got national level certifications and recognition for the work that we do there. And I'm a big fan, not just as a physician, but as the wife of somebody who survived a really bad cancer because of Roswell. Thank you.
Thank you so much. Appreciate it. Thanks for listening to Angles. If this episode made you think, smile, or see something in a new way, follow us wherever you get your podcasts. Leave a review and share it with friends. You can also follow us on social media. Angles is produced by Brett Tuttle. I'm John Richmond. See you next time.